Hello guys, today in this video we will be talking about detailed review of history taking for PLAB 2 examinations. So history taking in PLAB 2 is basically about getting a good idea of your patient's concerns and problems and being able to make your communication as effective as possible. There are different patterns for history taking, but we will be following a general pattern which is 3P MEFTOSA, which includes presenting complaint, past medical history, personal history, medication history, allergy history, family history, travel history, occupational history, social history, and anything else that the patient would like to tell you. Now coming to the presenting complaint, in this part we always start with the open questions and we try to put patient's own words in this part because we are here to listen to the patient's concerns, so try not to interrupt while the patient is explaining it, and also try to elicit the patient's ideas, concerns and expectations in this part. Okay, so we divide this part of present complaint into two sections. The first one is for symptoms of pain, okay, and the other one is any other symptom other than pain. For pain, there is a specific mnemonic that we have been reading since our undergraduate times, that is Socrates, which is a site, onset, character, radiation, and other associations, the timing, the aggravating and relieving factors, and the severity, asking the patient how would they score on the scale of 1 to 10. Okay, and the second part is any other symptom other than pain. For that, there's a mnemonic old para, which is onset, duration, progression, aggravating factors, relieving factors, and any other associated symptom. After presenting complaint, the second part is past medical history. In this part, we ask the patient if he or she has ever been admitted to the hospital for any reason, if he or she has ever undergone any operations for any particular conditions, or if he or she has any particular medical conditions like myocardial infarction, jaundice, tuberculosis, hypertension, rheumatic fever, epilepsy, asthma, diabetes, stroke, cancer. And there's a mnemonic for that, MJ-TRATS-CA. Okay, after past medical history, the third part is personal history. In this part, first of all, we need to ask the patient if he or she is okay if we ask any personal questions regarding to them. In this part, we take a detailed sexual history of the patient, asking them if they are sexually active, if yes, then whether the partner is male or female, and if they practice sex or not, like they use any sort of protections like condoms, and how many sexual partners did they have in the last 1 year. Are they currently having one partner or more than one? And have they ever been tested for HIV? Or have they ever had a sexually transmitted disease? In case of female patients, we need to ask a detailed menstrual history, which includes last menstrual period, the regularity of the cycle, days between periods, passing any clots, heavy or normal bleeding. And then we need to ask about the history of cervical smear, if the patient had one or not. If he had a previous cervical smear, then the results of the cervical smears need to be noted. And also the history of use of any contraceptions. If the patient used any contraceptions, then you need to take a detailed history of that as well. Okay, after that we come to the medical history. In this part, we ask about the medication that the patient take for any particular condition, and we need to note the dose, frequency, route, and compliance if the patient is taking the medications regularly or not. After medical history, we come to allergic history. In this part, we ask the patient if he had ever had any sort of reaction to any particular medication. If yes, then we need to clarify the type of medication and the exact reaction that occurred in response to that medication. We also need to ask about the occurrence of anaphylactic reaction, in which the patient experiences trouble in breathing, puffy face, and throat swelling. After allergy history, we come to the family history. In this part, we ask the patient if any of his family members is having similar problems, or if any of the family members has other conditions like heart problems, high blood pressure, high blood sugars. Then we come to the travel history. In this part, we ask the patient if he or she has been abroad recently. If yes, then we need to take the details of their visit as well. The next part is occupation history. In this part, we take the patient's job details and if he's retired, then what he used to do for a living. We also need to take a history for exposure to environmental pathogens, like a patient working in a dockyard may have exposure to dust containing asbestos, so the patient is most likely to suffer from asbestosis. Then we come to the social history. In this part, we ask about patient's accommodation, whether he lives in a house or in a bungalow, or if he is accompanied by any of his family members, or is he having any caretaker along with him. We also need to ask about his or her daily activities, if he is able to move independently or does he use any mobility aid. Then we also need to ask about his or her marital status. If married, then how many children does he or she have? Then we come to the addictions. If he or she smokes, if yes, then the number of cigarettes per day. If the patient consumes alcohol, then the number of units per week. And whether the consumption of alcohol has affected him at home or at work. In social history, we may need to ask further in regard to the presenting complaint. Like in a patient with a respiratory complaint, we must ask about the history of pets and birds at home and any exposure to dust. And for the patients presenting with a complaint of infectious diseases, we should take a detailed history of travel, including all occasions, exposure to water, exposure to foreign food, any risk factors for tuberculosis, any risk factors for HIV, and history of recent immunization. Once we have taken complete history of the presenting complaint of the patient, we must ask the patient if he or she would like to tell anything more about his or her complaint. Then we move to the systemic review. In systemic review, we go through a list of symptoms for major systems of human body. Starting with cardiovascular, we ask for chest pain, palpitations, peripheral edema, and orthopnea. For respiratory, ask about cough, shortness of breath, sputum production, and wheeze. For gastrointestinal, ask for abdominal pain, rectal bleeding, constipation, heartburn, and vomiting. For genitourinary, ask for dysuria and discharge. For neurological, ask for numbness, weakness, tingling, visual change. For psychiatric, ask for depression and anxiety. And for general review, ask about the history of weight loss and change in appetite. So coming to the summary now, always provide a short summary of the history taking, including name and age of the patient, presenting complaint, and relevant medical history. Then give a differential diagnosis on the basis of the history that you've taken, and in the end, give a brief investigation and management plan. Thank you very much. If you liked the video, please subscribe our channel and press the bell icon. Thank you guys.